Now, it is the most infectious disease in America, and more than 90% of us will get it at some point in our lives. And guess what? It's tooth decay or cavities. Now, besides being a painful, unsightly problem, cavities can cause serious health problems, even for children who haven't yet gotten their permanent teeth. But there are ways to prevent them. And to tell us how, today we're welcoming Tricia O'Hare, dental hygienist and editorial director of Hygiene Town magazine. Thank you so much for being here.
It's a pleasure. Thank you for inviting me.
Now, this is pretty scary. Cavities can be scary things, and I would think the best thing to do is to try to prevent getting them.
Absolutely, prevent that very first one. And even the great big cavities start out as very tiny ones, so we want to start preventing them right from the start.
Now, I would bet people watching this morning, you know, we've all heard of cavities, and I think people are probably thinking, well, those are those little holes that I get, and the dentist drills them and fills them in. But there's more to it than that, right?
Right. We used to think it was just holes that we would fill, but now we know it's a bacterial infection, and that the bacteria or the bugs in our mouth can actually produce acids from the foods we eat, and it's the acid that will melt the enamel and create the hole.
Now, where are we getting all of this bacteria that comes into our mouths?
Surprisingly, we get them from our moms. Babies are born germ-free, but moms are very generous with their kisses and tasting food, and they share saliva with the bacteria in it, so that's how kids get the bacteria.
So what do we do to try to prevent these bacteria from being in our own mouths, but also prevent them from going into our children's mouths?
Well, if the mom has very good oral hygiene and has a very low level of bacteria in the mouth, they're going to transmit a healthy bacteria to the baby, and that will make it much better for the baby.
Now, what about for moms or for women who are out there that haven't yet started having children? How can we start a good oral hygiene regimen now? Besides, I know we've always heard brushing and flossing, but I'm sure we can probably take it a step beyond that, right?
Beyond brushing and flossing, there's a sweet way to do that, and that's with xylitol, a natural sweetener.
Now, we have talked about xylitol on this show before, and it's, like you just said, it's a sweetener, but it's also found naturally, right? It's in the environment.
It's a natural sweetener, and it's removed from fruits, vegetables, from birch bark, from corn cobs. It's a natural sweetener that is also produced in our own bodies, and it's safe for diabetics, safe for pregnant mothers. It's a very healthy sugar, and one that will prevent tooth decay.
How is this going to prevent tooth decay?
That's a good question. The way xylitol works is that it actually confuses the bacteria. It thinks it's eating sugar, but it isn't, and when it eats sugar, it can produce the acid. So when it takes in a xylitol molecule, it doesn't have the nutritive value. It can't produce acid. It can't stick to the other bugs. It can't produce acid that will cause a cavity in the tooth. So the bacteria simply slide off the teeth. So you'll have 50% less bacteria if you use the xylitol several times a day.
Okay, so now obviously we need to get this into our systems. How can we do that?
It's fun, it's easy, and it's sweet. You can put the xylitol toothpaste in the morning with a mouth rinse to follow. You can use chewing gum, mints, candies. There's a mouth spray to help moisten the mouth. There's even gels for babies, and a gel that can be put into the pacifier so that the little ones are getting a slow dose of xylitol while they're using their pacifier.
Now, this isn't the same dose of xylitol that you're getting, because I've seen just in regular gum lines and candy stores, you know, the xylitol on the label, but this is a different kind, a different dose of xylitol.
This is a different dose, and on a lot of those packages they'll advertise xylitol, but they'll have other sweeteners in them that will actually produce the acid. So in order to get the results the researchers got, the products have to be sweetened 100% with xylitol, and most of these products are available at health food stores, not the grocery store line.
So it's not the candy line.
No, you have to go to the health food store to find these products.
Now, we were talking about mothers transferring it to their children and children needing, you know, healthy mouths. Are these safe for children and safe for, you know, nursing mothers, pregnant mothers?
Absolutely. These are safe for diabetics. They're used quite a bit with diabetics, so safe for mothers, pregnant mothers, children. It's even used in a nose spray for infants to prevent ear infections, and for adults to prevent allergies and sinus infections. So it's very safe because we make it ourselves in our body, so it's not a chemical.
How many times a day should we get this?
Strive for 5. If we have 5 exposures throughout the day, not all at once, but throughout the day, it will help to reduce the number of bacteria on the teeth all day long.
So after meals, after snacking, that kind of thing?
Perfect, yes.
And you can mix it up, the mints, the gum, the gels, the spray.
Absolutely, lots of different ways to do it.
You don't get bored. Well, thank you so much for joining us. This has been really fun.
It's been a pleasure. Thank you.
I've loved having you here. Now, if you want more information, you can visit the website, which is sprydental.com.